Let's talk about the no-scalpel vasectomy. So the vasectomy procedure is an office-based procedure to cut the vas deferens, which are the tubes that carry the sperm, and it's used to provide sterility in men. I have more videos discussing the vasectomy procedure in general, but today I want to focus on the no-scalpel vasectomy. So a scalpel is just a knife, basically a sharp instrument that's used to typically cut the skin, and typically you would use a scalpel to cut through the skin to get to the vas deferens, which are those tubes in the scrotum. So how can you do a vasectomy and cut those tubes in the scrotum without a scalpel to get through the skin? And the answer is you really just use another sharp instrument to make an opening in the skin. Typically, it's a forceps. It looks something like this. It looks kind of like a scissor, but the inside part is dull, but the tips are pointy. And so basically, you can put this pointy tip into the scrotal skin above the vas deferens and spread and basically create an opening in the skin that allows you to get to the vas deferens. And then from there, you can do your vasectomy. So what is the advantage of basically using a sharp forceps to open the skin versus using a scalpel to open the skin? And the answer is it's probably minimal, if any. In my humble opinion, the no-scalpel vasectomy is mainly a marketing tool where you can tell patients that, look, this is such a quick and easy procedure. We don't even make an incision. We don't even use a knife. But really, you're just using another sharp instrument to make an opening in the skin to get to the vas deferens. Now, the vasectomy no-scalpel technique was first described in China in 1974 and in the US in 1984. It became popularized in the US in the 90s, and now in the 2020s, probably almost half of vasectomies in the US are done with this no-scalpel technique. Now, no-scalpel enthusiasts might say that they can make a smaller incision using this technique. They might say they can do it a little bit quicker using this technique, but overall, the difference, if any, is minimal. So if I were going to get a vasectomy, I would look for a urologist who does a lot of vasectomies, and I'd let them use whatever technique they're most comfortable with. Now, if that's a scalpel or no scalpel, it really is not going to make a difference. Now, the no-scalpel enthusiasts might be upset about this. They might say that I'm missing something. If that's the case, please let me know. I'm always happy to learn. But from my perspective, no-scalpel vasectomy, scalpel vasectomy doesn't make a huge difference as long as you have a urologist who does a lot of vasectomies and can do the procedure in a safe and quick manner.